about the use of diuretics in hypertension. The mechanism of action, the classes of diuretics used, the advantages, precautions and adverse effects, contraindications and the possible drug interactions that can occur with diuretics. So starting off with what are diuretics? Diuretics are substances that promote diuresis. They increase the urine production and thereby reduce the buildup of fluid in the body. So amongst the various diuretic agents, thiazide diuretics is recommended as one of the first choice drugs in the management of hypertension. So what is the mechanism underlying the antihypertensive effect of diuretics? As we know that the normal blood pressure is maintained by a balance between cardiac output and peripheral vascular resistance. When a hypertensive patient is initially treated with diuretics, there is increased excretion of salt and water from the body. This decreases the extracellular fluid volume, decreasing the stroke volume and reducing the cardiac output. So the initial blood pressure lowering effect is due to a reduction in cardiac output. But soon the cardiac output returns to pre-treatment values, that is, it normalizes. This is followed by a decline in peripheral vascular resistance due to vasodilatation. Vasodilatation is caused by activation and opening of the potassium channels, causing efflux of potassium ions, and this in turn leads to hyperpolarization of the vascular smooth muscles. Hyperpolarization of smooth muscles can cause closing of the L-type calcium channels. This reduces the entry of calcium ions, causing reduced vasoconstriction and vasodilatation of the blood vessels. So due to decrease in peripheral vascular resistance and vasodilatation, there is a fall in blood pressure. So the initial antihypertensive effect is due to a reduction in cardiac output, but the antihypertensive effect is maintained over a long period because of a reduction in peripheral vascular resistance and a fall in blood pressure. So this is how the diuretics act. The various classes of diuretics that are used in hypertension are thiazide diuretics, loop diuretics and potassium sparing diuretics. Some of the examples of thiazide diuretics that are used in hypertension are hydrochlorothiazide, clothalidone, indapamide. Some of the examples of loop diuretics are furosemide, torsemide, bumetanide. Examples of potassium sparing diuretics are spironolactone, eplerenone, amiloride and primterene. The thiazide diuretics are used in mild to moderate hypertension in a patient with normal renal function. So in renal dysfunction, the loop diuretics are generally used. The loop diuretics are known to increase the renal blood flow, increasing the glomerular filtration rate, and this is beneficial in a patient with chronic kidney disease. Whereas the thiazide diuretics do not have much influence on the renal blood flow. Also, the loop diuretics are known to have a greater natriuretic effect compared to that of thiazide diuretics, and this is because the site of action of the loop diuretics is the ascending limb of loop of Henle, whereas the thiazide diuretics act more distally. The action is on the distal convoluted tubule, and therefore the loop diuretics are specially preferred in patients with advanced kidney disease when the glomerular filtration rate falls less than 30 ml per minute. Therefore, the loop diuretics are preferred over thiazide diuretics in the management of hypertension with advanced kidney disease or azotemia. Some of the advantages of thiazide diuretics are they have good oral bioavailability, a long plasma half-life that allows single daily dosing, and this increases compliance to therapy, adherence to treatment. Also, the antihypertensive efficacy can be achieved with a dose as little as 12.5 mg. It is to be noted that the maximal daily dose of hydrochlorothiazide is 25 mg. Doses higher than 25 mg are generally not more efficacious in lowering blood pressure. So, no greater reduction in lowering blood pressure, and at higher doses, there is increased risk of cardiovascular mortality, there is increased risk of sudden death. Therefore, if target blood pressure reduction is not achieved with a dose of 25 mg, a second antihypertensive drug needs to be added. The action of thiazide diuretic is additive with most of the other antihypertensive agents, and also the diuretic induced side effects are reduced by the addition of other antihypertensive agents. Therefore, combination regimens are common and rational. So this was about the use of thiazide diuretics in mild to moderate hypertension. So in severe hypertension when the patient is unresponsive to 3 or more drugs, thiazide diuretic may be added. Omitting or underutilizing a thiazide diuretic is a frequent cause of resistant hypertension. Also, hypertensive patients may become refractory to some of the antihypertensive drugs such as vasodilators and sympathetic nervous system blocking drugs. So, adding a thiazide diuretic may be beneficial in such patients. Vasodilators are known to induce fluid retention. They can cause edema. Therefore, adding a thiazide diuretic provides relief and normalizes blood pressure in such patients. Therefore, the indications of thiazide diuretics is mild to moderate hypertension in patients with normal renal function. Secondly, in severe hypertension when the patient is unresponsive to 3 or more drugs. And thirdly, patients refractory to drugs such as vasodilators and sympathetic nervous system blocking drugs where thiazide diuretics are helpful. Coming to the adverse effects and precautions with thiazide diuretics. Thiazide diuretics, because of the diuretic effect, causes loss of potassium in urine, and this causes hypokalemia as a side effect. Hypokalemia can potentiate ventricular arrhythmias and increase the risk of sudden death. Therefore, thiazide diuretics are combined with potassium-sparing diuretics in the management of hypertension. Also, rapidly developing hyponatremia can occur in some patients. Therefore, serum electrolyte monitoring in these patients is necessary. Secondly, thiazide diuretics when used for prolonged period can cause alteration in plasma lipids and plasma glucose levels. Therefore, thiazide diuretics should be prescribed with caution in a diabetic patient with dyslipidemia. Thirdly, erectile dysfunction is a troublesome side effect associated with thiazide diuretics. The next adverse effect is gout, which occurs as a consequence of hyperuricemia induced by thiazide diuretics. Next, thiazide diuretics are known to inhibit renal excretion of calcium, and this causes hypercalcemia. This is generally mild, but it can be severe in patients predisposed to hypercalcemia, such as in primary hyperparathyroidism. However, this can be used therapeutically in the management of osteoporosis and hypercalciuria. Thiazide diuretics when used during pregnancy because of its diuretic effect can cause placental hypoperfusion and can affect the fetus. Therefore, diuretics should be avoided in pregnancy. Now moving on to the uses of loop diuretics in hypertension. Loop diuretics are especially useful in patients with chronic kidney disease. They are also useful in patients with congestive heart failure with renal insufficiency. In patients with severe edema that is induced by antihypertensive drugs such as vasodilators, loop diuretics are useful and help to reduce blood pressure. Next, we move on to the use of potassium-sparing diuretics in hypertension. Diuretics, as we have learned, that cause excretion of potassium in urine, causes loss of potassium in urine, causing hypokalemia as a side effect, and hypokalemia can potentiate arrhythmias and increase the risk of sudden death. Therefore, potassium-sparing agents are combined with diuretics, and this helps to conserve potassium and minimize the potassium loss in urine. Now, some of the potassium-sparing diuretics are spironolactone, eplerenone, amiloride and triamterene. Spironolactone is an aldosterone receptor antagonist. It prevents the action of aldosterone, and aldosterone is known to cause increased reabsorption of sodium and water. So by antagonizing aldosterone action, there is increased excretion of sodium and water. This decreases the extracellular fluid volume and helps to lower blood pressure. So spironolactone shows blood pressure lowering effect, but the important drawback of spironolactone is that it causes sexual side effects such as gynecomastia and erectile dysfunction in men. So this is a troublesome side effect with spironolactone, and to overcome the drawback drawback of spironolactone, eplerenone was developed. To overcome the drawback of spironolactone, which is known to cause sexual side effects, eplerenone was developed. Eplerenone acts through the same mechanism of action as that of spironolactone, but it does not show sexual side effects such as gynecomastia or erectile dysfunction. Amiloride has some antihypertensive efficacy and trimethoprim has no antihypertensive efficacy. It is combined with the diuretics to minimize the potassium loss from the body. Thus, potassium sparing agents are commonly combined with diuretics to minimize the potassium loss and prevent hypokalemia. So this was all about the use of potassium sparing diuretics in hypertension. So now let's talk about the possible drug interactions with diuretics. The potassium and magnesium depleting activity of diuretics can potentiate the risk of arrhythmias associated with digoxin. So caution is necessary when diuretics are combined with digoxin. Secondly, diuretics decrease the renal clearance of lithium, leading to lithium toxicity. Non-steroidal anti-inflammatory drugs or NSAIDs decrease the antihypertensive effect of diuretics. This is because NSAIDs reduce the synthesis of prostaglandins, and prostaglandins, as we know, it increases the renal blood flow. So by reducing the prostaglandin synthesis, the renal blood flow is decreased, and this in turn decreases the antihypertensive action of diuretics. Next, ACE inhibitors and ARBs reduce the secretion of aldosterone, thereby causing hyperkalemia and conservation of potassium in the body. Therefore, potassium sparing agents should be used with ACE inhibitors and ARBs with caution, otherwise it can lead to dangerous hyperkalemia. So these are some of the possible interactions associated with diuretics. So we have discussed the use of various classes of diuretics in hypertension, the advantages, adverse effects, precautions, contraindications, and the drug-drug interactions. Thank you so much for watching.